I'm Neetha Dick, and I have the privilege of serving as the Dean of the College of Nursing at the University of Manitoba. Much has changed in the past 75 years in nursing education, within our communities, and around the world. What has continued at the College of Nursing is the high quality of nursing education, with its innovative and creative teaching and learning strategies.
The College of Nursing places an emphasis on the holistic health and well-being of individuals, that is, their physical, mental, emotional, and spiritual health. As an Indigenous person, this is very important to me. While nurses are often associated with treating the physical side of health, we are also there for the emotional and mental side as well. That is the art of nursing. You'll never forget the first moment that you sit with a patient and have them cry on your shoulder after they receive difficult news.
It took many years before the School of Nursing was approved to introduce graduate education. They were excited to be able to offer the Master of Nursing program in 1980, and 18 years later introduced the Master of Nursing Nurse Practitioner program.
What I learned in my education, specifically in a graduate degree, was really a focus on nursing leadership and the impact of leadership on frontline staff, and then the subsequent outcomes on patients and their families and our general healthcare system. And I use what I learned in my graduate education every day.
We didn't just study nursing, which is one of the things that I found so stimulating. We studied philosophy, arts, science, some education. There was really a broad range of concepts that one studied in order to become a registered nurse. It was a much broader and bigger idea than I had ever really realized. And I credit the College of Nursing for the coursework that they put us through.
My graduate degree allowed me to push myself. It was rigorous. It took all my thoughts from up here and actually allowed me to focus. And in that, I learned that theory and concepts are underpinnings in our practice, the impact of research on our practice, and the importance of nursing research to not only our patients and our families, but also to ourselves as a profession.
With the success of this master's programming, a PhD program was introduced in 2013. Support for advancing research and scholarship was provided to the Manitoba Nursing Research Institute, which later became the Manitoba Centre for Nursing and Health Research. And it resulted in a dramatic increase in faculty and student engagement in research and scholarship. We've also greatly advanced our research productivity and are contributing in a significant way to knowledge transfer through publications and presentations.
As a practice profession, I believe that nursing research and developing knowledge that can inform our practice is essential for excellent patient care. I feel privileged to be part of that process, and I feel challenged to not only think of how to develop solid knowledge to inform our nursing practice, but to also think about how to ensure that new knowledge actually impacts practice.
We're proud of our 28 faculty who are actively engaged in research.
I remember this evening when I had just about completed the project, and I sat back in my office at home, and I just had this aha moment. And the moment was realizing I love thinking this way. And the next thought I had was, could I become a nursing researcher?
I wanted to make a real difference in the care of children and young people, and the best way to do it is through research. The research that I do focuses on advancing the healthcare needs of children and young people in many areas, children living with cancer, children living with mental health issues, and so on.
Then in year 2000, with great excitement, the beautiful, brand new Helen Glass Centre for Nursing was opened, and it continues to house the College of Nursing today. The beautiful space just allowed for additional innovative and new initiatives, such as the Aboriginal Nursing Cohort, Simulation Centre, and expanded student lounges.
It's one of the people that really had a significant influence on me, and I think on the profession of nursing. In fact, I know on the profession of nursing in Manitoba, was Dr. Helen Glass.
She was the Dean of Nursing then, and we had a lot of opportunity to interact with her, to hear her and have her teach us.
Dr. Glass, as president of CNA at the time, along with other nurses in the country, were very influential in the wording within the Canada Health Act, which included nurses as providers of primary care in addition to physicians. And that was really, I think, a significant moment that opened up the thinking in the country to advanced practice nursing and to many of the advanced practice roles that we see in nursing today.
Much of what she saw from a global health perspective, from the possibilities of nursing, the professionalism of nursing and her pride in it, and her real commitment that our voice was important and our voice could be heard.
Simulation learning has changed dramatically, and we're proud of our state-of-the-art simulation center, where students have the opportunity to apply their knowledge and develop their skills in a safe learning environment. I'm excited about the future of the College of Nursing. We will continue to build the remarkable legacy we're benefiting from.
I believe that the College of Nursing needs to prepare nurses for the next 25 years to ensure that they are educated in ways to meet the public's expectations. And not only the public, patients and families, but also our healthcare system.
There are opportunities for students to travel as an undergraduate student or as a graduate nurse and work in many, many parts of the world and take what they have learned here at the University of Manitoba and use it to enact nursing practice in a way that may not be known, but they can be like our trainer of trainers. They can teach others how to advance nursing knowledge and nursing practice.
So what will it look like 25 years from now?
I see the college as a medicine wheel, in a sense, as in people from all four directions are coming together within a circle to promote health and healing.
We will see great advancements in research, and perhaps we'll see major breakthroughs based on the research that's been done. For example, a researcher who's working on the children's experience with cancer.
Thank you, College of Nursing. Thank you for supporting my career over the years, and I hope to continue to do the good work that I do in research and also advancing this College of Nursing.
We will continue with innovative teaching and learning strategies.
Relationships are at the core of all the work that we do. And when you work with people in other countries, you bring so much back as a person to your role as a nurse, as a faculty member, and as a colleague.
We will be further advanced in terms of the use of simulation and have introduced augmented reality. We will have advanced in interprofessional education and preparing nurses to work in interprofessional collaborative practice.
I feel very grateful to the College of Nursing for the many opportunities that have been offered to me, both as a graduate student and as a new faculty member. I'd like to express my heartfelt gratitude to all the faculty members who've taken the time to mentor me and include me in their projects and have also joined my projects as a new investigator.
I thank you for being beside me all the way along as my career has unfolded. There's a tremendous strength here in this College of Nursing.
We'll make a great contribution in knowledge transfer through further publications and presentations. We also have the unique opportunity right now to develop a brand new degree program, the Bachelor of Midwifery program.
I wish the college all the best in the next 25 years as they move forward.
I would really like to thank the College of Nursing for the opportunities they have afforded me in my work internationally.
We look forward to celebrating our 75th anniversary together with you. Thank you for joining our celebrations.